is just a masterclass about radiographic positioning, and this is something that a lot of people struggle with, and for good reason, because there are so many different types of systems, X-ray sensors and plates and whatnot, and so what I would like to do today is just to show you kind of what I do, how I do it, and I don't say it's the correct way to do it. There are many ways to position the patient. Some do lateral, some do ventral dorsal. But you may be able to take some ideas from what I do and implement it in your own work. Okay, awesome. So for those of you who don't know me, my name is Morten. I'm a Danish veterinarian. I graduated 12 years ago from University of Copenhagen, and I have had a huge interest in dentistry ever since. And recently, the last 2 years, I have exclusively worked with dentistry patients. So this is kind of my dream position right now. I'm teaching dentistry online, and I am working only with dentistry. So it's really good. I took all the ESAF's courses in Luxembourg and in Dublin, and I took some other additional courses too. So that's kind of my background. And let me just go ahead and say that this is recorded. So if there are problems with the internet connection, I know sometimes Zoom is not perfect. So if there's a lagging, if there's a problem with the picture, just know that the recording will be perfect, because I'm doing a screen recording right now, so it doesn't depend on the internet connection. So if you want to rewatch something, you will get the link in an email in 2 hours from now, I think. All right, let's jump into my presentation. So I'm going to share my screen. So what I will do is I will speak for about maybe 30-40 minutes, and then we will do a brief introduction to how I may be able to help you get even better, and then there's going to be 10 minutes or so for questions in the end. So let's see, move this over here. I'm going to present full screen. Let's see. Okay, and if there is any issues during the presentations, please speak up. Okay, great. So this is like the perfect set of X-rays. I did not take these images. This is what you are, if you are going to be a resident, a diplomat, this is kind of what you are expected to submit, like the perfect set of X-rays. And we are not trying to do perfection. We are trying to do to take an image that is good enough so we can see what we want to see, but not so bad that we cannot see the bone levels and so on. So let's say you take a photo, an X-ray, where you miss one root, okay, or you think the angle is bad. Don't delete those, because you always need them, because sometimes you want to go back and you want additional views on a certain tooth, and maybe you see that tooth, part of that tooth on another X-ray, so they can become very handy. So I don't think there's like bad X-rays, because you may need even the ones that you don't think is too good. Okay, so I'm going to shut this down here. So the importance of proper positioning of X-rays. The way we have to think about X-ray beam is like the sun and a tree, and you've probably seen this, a lot of you. So imagine the tree is the tooth, and the shadow is the image you get on the X-ray film, and the sun is your X-ray beam. So the further down your beam is in comparison to the tooth, the longer the tooth will be. And again, if you position it too vertically, then the tooth will be too short. So we are trying to find a middle way where the tooth is not extremely long and not extremely short. Okay, if I'm a little unattentive here, I'm just trying to let people in while I speak. Okay, so these are some 2 x-rays, and I would say I took these pictures. This is not good and this is good, and I'll explain you why. This is how you can kind of check, is my x-ray good enough to measure bone height, for example, because we need to measure bone height in order to evaluate periodontitis and bone loss, vertical bone loss. This picture is a little bit oblique and the roots are too short. How can I tell that? I can tell that by looking at the crowns, because what you see here is there's a distinct difference between crown and root, and the crown has a line here. So you see this white line, you're not supposed to see that overlapping the root. When you compare the good picture, you don't see this line. And this line is the crown overlapping the root, because you are shooting too high, so the tooth is getting shortened. And when you shoot, like make the roots too short, you can see this line of bone right here. This is what you use to evaluate bone loss, how much bone has been lost. But because this is an oblique picture, you're not able to evaluate fully, like if this bone loss is up here or down here. So by making this tooth correctly positioned, you can see exactly where the bone stops. So that's a task for you. Look for these lines to make sure that the angle is good. So ideally, when we take an X-ray, we want to shoot, we want to have a direct representation of the tooth. And if we could shoot all teeth in a direct lateral fashion, put the film perpendicular to, or in the same angle here as a tooth, we would get a perfect image every time. And this is what we do on our normal X-ray. When we take pictures of the extremities and so on, we are able to place the film directly underneath our object in the same plane. So we don't have really problems with having to position like we do with dental X-ray. But the problem with the oral cavity is this. We are not able to place the film up here because we have a palate, okay? And we have a mandible, at least the rostral part of the mandible, we cannot do this. For the caudal part, we can actually do this. But for the rostral part or for the maxillary, we have to place the film in oblique manner. And that gives us a challenge, because then how should we now position the X-ray beam to get a perfect image on the film? And that's where the concept bisecting angle comes in. And the bisecting angle is like the middle way between the plane of the film and the plane of the tooth. So the axis of the tooth here and the plane of the film, and then you go halfway. This is your bisecting angle, and this is the exact plane where your X-ray tube should be 90 degrees to this plane. So that's why when we position the patient and put the film in and try to position the head, we always we stand and we watch, okay, where's the tooth and where's the film, and then we're imagining where should we place the X-ray tube. And it's a big, it's frustrating, and we have to spend a lot of mind power and a lot of thinking about where to position it every time. My best advice for this is try to make some constant factors, and the constant factors should be how you place the head of the patient. If you place the head of the patient in the exact same position every time, you can eliminate that factor, and you will always know if you place the film correct, then the X-ray beam should be positioned the same angle every time on every patient. But if you flip the patient on the side and then a little bit obliquely, and the patient is not in a constant set in the same way every time you do dentistry, you have to think a lot more, and it takes a lot more time, and you have to do more retakes and so on. So this is my advice, is place the dog in the same position every time. I will show you exactly what I do. So what I want to show you first is where do I actually place the film in the mouth of a dog. Okay, so I'm using the phosphor plates. Some of you will be using direct sensors, which is on a cord that you plug into the computer. The phosphor plates are good because they are, if they get damaged, you can replace them. You don't have to buy a whole new system. But on this plate, you see some markers. So you have a front side and a back side. And you should always shoot, if you have the same IM3 or similar, you should always shoot on the back side. If you inadvertently shoot on the wrong side of the film, you will still get a picture, but it will be flipped horizontally. And that will confuse you when you're looking at the picture. Okay, so is this the right side or the left side of the dog? And the good thing about when you shoot on the same side, on the correct side every time, you will always, with a little bit of training, with the correct technique, you will always be able to look at an X-ray and tell immediately, okay, this is 204, this is 108, this is 309, without having to put numbers and write numbers on the picture. I guess some of you probably are writing numbers. Okay, this is 309, you put it on the computer to see, but you don't have to do that. There's an easy technique you can learn, so you don't have to spend time writing on the pictures. There's another marker here, this is a dot, and on the other side there's a number. Some people will use this dot as a marker and they will place it somewhere they can remember, so they know what tooth is what when they look it on the screen. But as I said, it's really not necessary to do anything like this. But so these come in protective sleeves, and so you just slide it in, and so you can just remember you got to be able to see these numbers through here, and then you shoot on the back side. So when you place it in the mouth, you have to, let me see, I may have to fast forward a little bit. Where is my... Okay, here we go. Yeah, so I'm just showing the difference between size 2 and 4. Obviously, size 2 is smaller and you will have a harder time getting all of the tooth sometimes if it's a big dog on the film. But let me show you the concepts of where to place the film. So you want to place it so the edge of the teeth are positioned on the edge of the film. Don't put them in here in the middle, because if you place the edge of the teeth in the middle of the film, you will have nowhere to cast your shadow with the X-ray beam. So imagine when you shoot an X-ray this direction, the shadow of these roots have to fall onto a film in here. But if the film is partly outside the mouth, you will never get the root tips on that film. So that's the first concept. Always position the film so the teeth are touching the edge. Okay, so you have most amount of space, X-ray film in there to place your picture on. And when you are shooting the canine tooth, you have to place the tip of the canine tooth on that edge and shoot in this direction down, so the shadow of this root will be laid perpendicular to this film. This becomes a problem when you have a large breed dog and only a size 2 film, because you cannot fit the crown and the root and everything on the film. So you have to choose one. Depending on the case, you mostly have to choose the root, right? So you have to push the film a little bit further in, knowing that you will not get the whole crown on the film, but you will get the root, and you may have to take more pictures. Okay, so the concept is the same for the incisor. Shove the film inside the mouth so the tip of the teeth are here. Okay. Going into the mandible, when you are taking X-rays of the caudal part, you can place the film in the same plane as the teeth, as I showed you before. So this is advantageous for the caudal part here. I'll show you a clinical example later. But when we move the film further rostral, you will have the symphysis of the mandible will prevent you from positioning it in the same way. So you have to do the bisecting angle technique when you are taking x-rays of the rostral part. That means placing your film here in a 90-degree angle compared to the teeth. Let me fast forward a little bit. Same goes for the canine tooth, goes on the tip here, and so on and so on. Okay, I think we watched that video. Let me see. Okay, I'm trying to not make things confusing here. Okay, present, full screen. All right. Oh yeah, another concept I want to show you is something called the extraoral technique. The extraoral technique is nice for getting the caudal molars presented nicely. Or if you forgot to turn your patient, you turned your patient and you forgot to take an x-ray before you turned, you can actually take photos of the teeth that are positioned on the table with the extraoral technique. And this technique is you open the mouth wide, like with a mouth gag, you position the patient onto the film and you shoot through the mouth. So imagine this is the x-ray beam, you shoot in this direction. So if you shoot in an oblique angle here, you will get all of these teeth onto the film and you may see the shadows of these, the dorsal aspect of your x-ray, but that doesn't matter. These are the teeth of interest. So if you shoot in like a 45-degree angle, you will get these teeth. And this is a concept you can use for cats because the caudal maxillary teeth in cats can be tricky. You will get excellent pictures doing this technique. You can use it in dogs after extraction of the 9 or the 10. Sometimes I even like this. I like this image more than the conventional one, but it's just a little bit cumbersome to do. I don't do it routinely, but you actually get a very, very nice picture. The only thing you have to remember is when you shoot from the inside out and not outside in, if you know what I mean, you have to flip the picture horizontally. When you have developed it, you need to remember to flip it horizontally. So you have to mirror, or I say mirror horizontally. If you don't do that, it looks like it's the opposite arcade you took the pictures of. That's the only time you're allowed to mirror the pictures or flip them. You can only rotate x-rays. When you are putting them up and mounting them, you can only rotate. You can never flip because I will confuse you. There's another way of how to get the caudal molars onto the film is by placing the film like this in an oblique fashion. And then you can shoot straight down like this in this direction. This is also useful for cats. This is called the almost parallel technique. Like a crazy name, but almost parallel. If you look it up on Google, write almost parallel. And that's another way you can get a nice picture of those molars that are so hard to get. Okay, I hope it helped with how to place them. Okay, next slide. If you're using a size 2 sensor, a little trick can be to wrap it with wet wrap to prevent it from slipping and sliding everywhere in the mouth. So there are lots of techniques how you can, a lot of different ways to do it, how you can prevent this from slipping, but some wet wrap around it would be nice. And as the inner part, maybe a protective sleeve so you don't get the saliva and bacteria all over your sensor all the time. But this was just to show what you can do. So it's helpful for some people. So having a size 4 is amazing. I must say, if you're used to size 2, getting a size 4 system, this will be blowing your mind, because you see how many, you can get entire arcades of teeth onto the same film. And this will dramatically speed up your x-ray time, or speed up your, yeah, you know what I mean, and reduce the retakes, because you get so many teeth on one. So you can be maybe less precise if you go up in size. So I really like my size 4 sensors. Okay, let me just kind of walk you through how I position the patients for my x-ray. I always place the patients in ventral recumbency first, like this. So immediately after I intubate the patient, I will just place a towel underneath the head, and that's when we start taking x-rays in that position. I don't clean first, I don't examine the mouth first, I take x-ray first. You may have heard, no, you cannot take x-ray first because there's calculus and there's you need to get rid of calculus to be able to see what you want to see. That's not true. That's not true. You can see some calculus on the teeth, but we're not interested in looking at the crowns really. Maybe in cats we are, for tooth resorption reasons, but in dogs we want to see the bone loss. We want to evaluate periodontitis. So this is a way that you can dramatically speed up your whole process of going through a dental patient. Start with x-ray, because when you are done with x-ray, that's when you examine the mouth. When you're done with that, if you're so lucky you have a nurse or somebody who can clean for you, then while they are cleaning, you can make an estimate, call the owner, make discharge notes, all of that stuff while somebody is working on the dogs. And you can even place your nerve blocks before you clean, because you already know which teeth you want to extract, because you took x-rays, you examined the mouth before you started to clean. There are a lot of benefits to doing it this way, and you avoid having to call the owner all the time. I heard some vets will say, okay, we'll check one side, take x-rays, examine one side, then we call the owner, say we found this, but we still need the other side. Then they turn, then they clean, x-ray, call the owner again. It gets confusing. So I want gather all your information first and then call the owner. But also another point is, if you clean first, examine first, then do x-ray, now you have a gap where you gathered all your information, but you still need to talk to the owner before you need to do anything else. And while you're talking to your owner, making estimates, preparing nerve blocks, what's happening with the dog? Nothing. It's just waiting and wasting time. So by doing x-ray first, this is really good. So this was a tangent, but it's very important. It's something that helped me speed up my entire process a lot. The first image you are taking should be the molars, and I like to position it so you shoot kind of from back to the front in about 60-degree angle. When you do that, you get a very bad picture of 108, but you get a great representation of that very important area here between the 9 and the 10. It is exactly this triangle you want to look at to look for bone loss. And there's always, in those small breed dogs, it's very common that there's completely black here because there's bone loss. Now you already know, okay, this 10 is probably going to need extraction, and you have to check the 9. So this way to position it right here will make a very nice representation of the last two teeth here. Next one will be about 45-degree angle, straight lateral, and that you will have a better image of the 8. So see, this one is not a perfect picture because the crown got cut off, but even with the crown getting cut off, you will still get a lot of information about what's going on here with the roots. Okay, the next one is canine tooth, and for the canine, the mistake that a lot of vets do is they try to shoot the canine at a 45-degree angle. If it's a large breed dog, you will not get the root tip on. So another way to do it is to position it kind of obliquely and a 7-degree angle. What is a 7-degree? If you take your hand and do the peace sign, so your index finger is pointing straight up into the air, your long finger or middle finger will be 20 degrees from that. So this is the exact angle that you need. So the middle finger, that's where your X-ray beam goes. Okay, so it looks almost perpendicular, but this is how you can ensure that you get the entire canine tooth on the film. And again, I'm just short video where I show you what about in large breed dogs. I like to use these protective sleeves because they protect the film from the forces when you are placing them in sternal. Okay, so this will not work. 45 degrees, you will not get the root tip. So move it up, 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 up like this. And that's when you get the entire tooth on the film. So does anyone here have had this problem where they could not get the apex of the canine? Yeah, that's usually the issue. Okay, this is acting up here. Let me see if I can present again. So usually it's just because you placed it too low. Okay. All right, let's see that X-ray again. Okay, so yeah, this is what we want, and this is possible with a size 4 film. If you have a size 2, you kind of have to select, what do I want? Do I want this part or do I want this part? Okay, so it's not always possible with a size 2. But so you may have to take 2 pictures of that. Okay, good. For the incisors, about 55-degree angle from the front down. That's what I use, and you'll get a nice representation here of these teeth. Again, the other canine, 70 degree. If you look at this tooth down here, can anyone see what's going on? Almost looks like it has a 3rd root. Yeah. Sometimes these premolars have 3 roots. That's a reason why doing X-ray before extractions is good, because if you expect it to have 2 roots like they do in 99% of the time, and it has 3 roots, you will leave a root when you extract it. So, okay, again, 45 degrees for the premolars, and that 4th premolar also. Here on this tooth you can see there's an uncomplicated fracture. You can see it's fractured, but it does not seem like it has entered the pulp, because the pulp stops about here, but you have to check that with your Explorer when you are looking at it. Okay, again, that caudal to rostral 60-degree position will get you that nice representation of these teeth. Okay. Now I flip it. Okay, so I turn it on dorsal recumbency, and I slide my film in as deep as it will go. You will have when you can feel with your finger up here the edge of the film kind of poking through between the mandibles. That's when you have positioned it correctly. So you can push it very far in. I push it on next to the tongue. Okay, I can push it far in, and then you can get that nice lateral projection here. For the premolars, 55 degrees. If you shoot only 45, they will get too long or too short. No, sorry, too long. So you have to move up a little further up than you think compared to the maxilla, about 55 degrees. You can try and check when you're doing this. And looking at the X-ray, we see unerupted 305 here, and we see 2 root remnants sitting here. If this was an old dog, an unerupted 305, does anyone know what's the problem with the unerupted tooth? What could be the problem? Just unmute your mic and let me know. I know you know it.
Dentigerous cyst?
Yes, exactly. So dentigerous cyst could be a problem. But always think, if this dog is maybe 6, 7, 8 years old and there's no cyst yet, there's probably not going to be a cyst ever. About 30% of the unerupted teeth will develop a cyst. But if you find this in a young dog, it's always best to get it out. But I will just let you know that in my experience, and these cysts, if they want to form a cyst, they usually form pretty early in this dog's life. Okay, so if you find this in an 8-year-old dog, no cyst, I would leave it and monitor. You don't have to go in and go after it. On the other hand, though, these root tips, I will want you to go in and get them out, because we know about 50% of root tips are inflamed, even though you cannot always see it on X-ray. And I had, in a 12-year-old dog, I had a fistula forming from a deciduous root tip in a 12-year-old dog. So it had it had some inflammation there. Okay, what's going on? All right, next picture. Again, 70 degrees. Make sure, I want to point this out. Make sure that you put a towel or something underneath the neck so that the chin is level. So it needs to be horizontal. If the head is turning, if the nose is pointing more up, then you have to adjust your angle accordingly. So it's always in relation to the dog, not in relation to the table. So if you make sure that the head of the dog and the chin is water level, so horizontally placed, then you can count on these angles. But if you start to move the head around, everything will be messed up. You have to stay within the limits. Okay, 55 degree again for the incisors. You can see some bone loss here in between these incisors. I would expect some pockets. I do also see a lot of very small breed dogs with seemingly a lot of bone loss, but absolutely no pockets, no bleeding, nothing, normal. I would leave those if it's completely normal, no pockets, no gingivitis, nothing. So that's for small breed dogs. I think it can be deceiving sometimes. When you are placing them, when you're taking these x-rays, always place the film over the tongue or under the tongue or whatever you want to call it, but in like this, okay? If you try to shove your film in here between the tongue and the jaw, it will not work. You cannot put it as far in as you want. So always shoot through the jaw, through the tongue, onto the film. The tongue is just soft tissue. It will not make any difference to your x-ray, but that's a mistake I see people do. They try to position the tongue under the film. Don't do that. Just put it like that. It will get much, much easier to do. Okay. Again, 70 degrees, that's for the other canine. Let's look at the x-ray. Sometimes the incisor pictures, or if you want another view of the incisors, looking at the canine tooth projection is good, because then you can get a very nice representation of this 1, 2, 3 incisors. What's going on? Does anyone have an idea what's going on with this tooth? I can tell you it's unerupted. What else? Do you see any other problems with this tooth? Just unmute your mic. Anyone? As a hint, look at the pulp chamber and compare it to the teeth next to. All right. I'll reveal it. The pulp chamber is wider than, look at this canine tooth. The pulp canal is very narrow. This dark area here, this is the pulp canal, is wider than the adjacent teeth. Compare it to similar teeth next to it. It's wider. So what does it mean when the pulp is wide? The tooth is dead. It's non-vital. It's not alive. What happens if you leave a tooth that is dead? It will cause a cyst, a granuloma, or an abscess. It will always cause it. No exceptions. So you have to get that out. Okay. Let's move on. See if I can. All right. Again, 55 degrees. You see a little bit of bone loss here. And straight lateral again for the molar. So that's how I placed it in dogs. If you have French bulldogs, pugs, brachycephalic, you can make up your own angles, because it doesn't matter how organized you try to be, it will always look like shit. So you just have to try and then move the beam a little bit, and okay, so that's a whole nother talk. But yeah, so that's how I do it in dogs. And if you place the dog in the same position every time you do X-ray, the only thing you have to remember is this number. Okay. So 60, 45, 70, 55, 70, and so on. And some of these X-rays beam, they have an angle measurement where you can see the angle up here somewhere. So not this one, doesn't have it. So you have to memorize where it is. But you can make it easier on yourself if you place the patient in the exact same. You can take X-rays in lateral. That's fine. A lot of people prefer lateral to this, but I don't like it too much, because you have to turn the patient all the time. I like this concept of doing exactly the same thing every time. This is just how I do it. If you like lateral, please continue doing that. For cats, what I often hear is the problem is getting a good view of the maxillary molars. And oftentimes you may recommend or may recognize an image looking like this, where the roots are kind of short and you have all this white stuff covering the crown and the roots. This is the zygomatic arch. And cats are challenging because the zygomatic arch wants to obscure your view. So if you take a normal 45-degree angle, like in the dog, you will have a picture looking somewhat like this. But if you instead move the beam down, so you get instead of more like a 30-degree angle, what happens is your roots will get a little bit elongated. They will appear longer than they are, but the zygomatic arch will move up away from the roots. So you have a better way to evaluate these teeth with the zygomatic arch being up here instead of in the middle of everything. If you still cannot get a good image like that, maybe try that oblique, that near parallel technique where you place the film oblique in the mouth. If you still don't get a nice picture, then try the extraoral technique where you place the cat on the side, open the mouth, put the film under the cat, shoot through the mouth. So these are 3 different techniques you can try to get a nice picture of the caudal molars in cats. So this is me just walking you through how I do it with cats. Again, I place a towel underneath the head, and let me see if this is running or not. Okay, so again, place the film so the teeth are positioned here on the edge of the film. I may have to fast forward a little bit, but we'll see. It's not too long, this video. So this is how I place that film. If you have a size 2 sensor or in a direct sensor, some of them can be placed just inside the mouth. Both of the arcades will rest on the film. I recently learned some of you have a little more narrow films and they will be very unstable in there. And you may help that with putting some wet wrap around them like I showed you. So see this picture, the roots are too long. We agree on that, but the zygomatic arch is gone. So this is not a perfect picture. It's acceptable if you if you evaluate it together with your clinical examination. Again, X-ray is only half of the evaluation. So I don't recommend relying only on X-ray. You also need that clinical assessment with your Pro and your Explorer and all of that stuff. Okay. Let's fast forward a little bit for the canine tooth. Again, let's see. This is what it looks like. So I place the tip of the tooth on the edge of the film and I shoot in this direction. It's no longer that 45 degree. You can see the position here. When you place it like that, you will get an image like this. Now incisors. That's the direction, about 55 degrees. So how far should you place your X-ray beam from the patient? Some will tell you put it all the way down to the patient, but my recommendation is if you move it a little bit further away, you will have an easier time getting utilizing the whole film. Okay, getting teeth on the whole film. And even though if you move it a little bit further away, you will not have a significant loss in quality. That's the other canine tooth. So again, place the tube underneath the film, endotracheal tube, and now I go, see how far down I go? This is that 30-degree angle. So you almost feel like you're shooting horizontally. But if we move it up, as a demonstration, to about 45-degree angle, we should see the X-ray here in a little bit. See, doesn't look very good. Zygomatic arch is everywhere. It's not really a great picture. So I hope it helps with the cats. That's the most common thing I hear is problems with molars in cats. So by seeing how I do it, I hope it helps you in yeah. Okay, let's see if I can move this. Sorry for these technical problems here. Okay, so that was the cat. Let me see if I can make this work again. So for the fourth premolar, there is another consideration, and that is the roots. So when you look at the tooth here, these are files. So this was a tooth that is getting a root canal treatment. But you can see it was just a way to show the three roots. Okay, so you have the two mesial roots here. Mesial is the front part. You cannot say cranial because you're already inside the cranium. So with teeth you say mesial or distal. So you have root here, root in the middle, and a distal one. So which one is the palatal root? You know, one is more palatal than the other. Which one is it? It's actually, if you shoot like I showed you to shoot from behind here and back, the palatal root, which is in here, will always be in the middle. Always, no exception, if the tooth is kind of positioned correct. So the mesial root here, the mesiobuccal, so the lateral root, will be this one, if you look at these fingers as a representation of the tooth. The palatal one in here will always be in the middle, and the distal one will be in the back, like this. So this is the mesiobuccal, the palatal root, and the distal. Okay. And it works every time. Okay, so I already spent 48 minutes of your time, and time is flying. I hope you got some nice concepts out of what I'm trying to show you. You may want to re-watch this again because there's a lot of information in a very short time, but you will get the recording. I just want to spend 5 minutes of your time talking about, if you like this way I present things, if you like the way I teach and show you things, you can actually work directly with me for 6 weeks to increase your competency in all of the aspects of dentistry, not just x-rays. So I just want to briefly steal 5 minutes of your time just to let you know how I can offer my help to make you even better with dentistry. So I made a 6-week coaching program. The way it works is that you will get access to a lot of modules that you can watch on your own time. So you don't even have to take time off work to go to a course. It's all online. And I made like 6 modules with video lessons that you can watch at your own time. The first one is about client communication. We all heard owners say, oh, it's still eating, so it's not painful, or how can it eat when you remove those teeth? And this one I really love this one. I've had dogs for 30 years, none of them ever had any dental problems, and they are there with a Cavalier, or I had one yesterday, said, I had Yorkies for 30 years and they never had any problems. And what do you say as a veterinarian? You say, okay, all right. Did they ever go to see the dentist? No. Okay, maybe that's why you didn't see it. But all of these things we are attacked with every day, I have the answers for you, exactly how to respond and how to make everyone and yourself happy, and to make the owners say yes to your recommended treatment. So when you recommend something, they say, okay, I see why that's a problem. I want it. So when you get the patient in, you want to be able to diagnose properly. So you don't want to miss disease. You want preferably to do full mouth X-ray on every patient. And how do we actually go about examining that mouth? What is this lump, this bump, this mark? How do we know what's normal and what's not normal, and how to write it down, how to chart, what equipment to use, and so on? I have all of this stuff packed for you inside the course. This lessons that I showed you today is an outtake from what is inside the course, so you can recognize some of these videos here, pictures. So these were some of the videos from the course, and there are more videos about X-ray, and also teaching you that technique I talked about. How, like when you look at this picture real quick, I can easily say, okay, this is 409. Without even thinking about it, I know this is 409 and not 309 or something else. And if you have problems with that, you can learn in 5 minutes, you can learn the exact technique on how to look at the X-ray and see what tooth is what. So you never have to write again here 409 and mark it on the X-ray. So another thing is, let me turn maybe there's audio here. How to reduce all that stress. You know, we are sitting there, we are stressed, and we haven't had time to eat anything. The receptionist comes in, oh, your next appointment has been in the waiting room for 5 minutes, and are you done yet? And as soon as you hear that, that's when you fracture the root tip, and now you know, oh my God, this is so stressful. And a part of this reason is we simply have too many patients, and we have not, put the importance into making dentistry important. It's not something we can do quickly. We cannot do 6-7 dentistry procedures a day. So there are some things that needs to change in order to reduce your stress levels. So I'm touching on how you can talk to your boss about reducing this, making this easier. If you are the boss, then how can you help your employees don't feel so pressured as they do today? It's okay to schedule, treatments so you don't have to do everything in one setting, actually. And the owners, they don't they will agree. So I do have lessons about how to reduce that stress that you are experiencing by setting some healthy boundaries for yourself, for your boss, for the client, and so on. This is a huge module in the course. If you are a visual learner like I am, and you know, oh my God, tomorrow I have a mandibular canine tooth I'm going to extract. How was it I was supposed to do that? How much bone should I remove? How do I make that flap close again? Don't worry, I got you covered, because I have a huge section with step-by-step extraction videos recorded in the with my cameras that record in 4K, so you see all the details step by step. They are narrated, and you can go back even after the course and watch these videos again and again until you got this dialed in, the surgical technique. So this is what I'm really proud of, making all of these videos that are should be very clear to follow, to know how to release the flap and so on. Okay, and then some bonus infos in the last part of the course about how to do some basic jaw fracture repair when you are on your own in the clinic. Saturday evening, there is a cat with a fractured jaw. It may not be perfect, but how do I stabilize this jaw? Or it has a fractured tooth. How do I protect this tooth? Either with a restoration or just some bonding, different procedures. Okay, so this is like an introduction to some of the more advanced stuff that you can do. A lot of this has to be learned in, it's best to train it in a wet lab, of course, to get it in your hands. But this is a very nice beginning to learn these things. Okay, and the best thing about this is, you know that when you go to a course, you have to learn something very quickly. Sometimes the teachers are rushing through because they have like 500 PowerPoint slides they need to go through, and you go home and you say, oh, I have all these questions that I forgot to ask, and so on. What I offer, what's a little bit different with my courses, is that you will have access directly with me for 6 weeks. So every time you have a question, every time you have a case you're not sure how to proceed, you just ask me in a chat on your phone, and I will answer within 24 hours, usually much quicker. But if I'm doing surgery myself, you maybe experience a little delay. But so I really think that getting that help with implementing the things you learn and being able to ask someone and share ideas, I think this is invaluable. And I've had, it's a really great thing with this course that you don't find anywhere else. Okay, so thank you for not falling asleep listening to my little speech about how I may help you if you ever want that. We begin in 1 week, actually 5 days. The next module we will begin. So let me know if you have any questions about how to join. So now let's take 10 minutes, and I would love if you have some questions about X-ray, about anything else. You can either put them in the chat, or you can unmute your mic and let me know. Let me just have a look in the chat to see what we've got. I'm just gonna, where do we have stops here? Okay, let me look in the chat, and you can think about questions while I look. Okay. Oh, you got Phoebe from Philippines, new grad. Awesome to have you here. Sarah said, for handheld X-ray devices, is there minimum distance that you must maintain between the patient and the device when taking X-rays? I don't use the handheld. I have a fixed one, but the minimum distance, I couldn't answer that because I don't use these machines, but I think you should be able to use them like you do with conventional X-ray. If anyone here has experience with it, please just speak up. That would be helpful. Okay. Okay, so Phoebe says, what if I join in the future and I'm not yet in clinical practice? Is that suitable? Is that good a time for me to join? Or just wait when I'm in practice to utilize your program? That's a good question. Should you join the program if you're not in practice, or if you don't see a lot of dentistry patients right now? I think there's still a lot of learning that can be done so you can hit the ground running when you see your first patient. So that's one thing. I don't know how long I'm able to continue these programs. If I will probably make some next year also, but I'm also working on other things. So this is So basically, I have one more now that I will, and probably one in November. So let's see. All right. Let me see if we have questions. So a lot of you think this was helpful. That's very nice. Will we get a copy of the recording? Yes, you will. In about 2 hours, you will receive an email with the link to a recording. Okay. So Emma said that she will give the plate on the table and shoot through the mouth a shot for my next 109, 209. I think that's really great. So let me see that X-ray when you take it and send it to me. I want to see it. Awesome. So does anyone have a question? Any other questions? You can just unmute your mic. You don't have to spend time writing. Just speak up. We are not shy here. We are all family. No? All right. Thank you for being here. I really appreciate you taking the time. I hope that you will have success with your x-rays. You'll be able to reduce your retakes and take less time. Ideally, when you get really good and have a good system, good sensor, good plates and like that, you can do full mouth x-rays in 10 minutes in a dog. If you have the size 2 plate and a digital sensor, you may want to accept a little longer, but you can really cut down your time a lot by making some constants, like placing the patient the same time or the same way every time. All right, super, awesome. So if you have any questions that you thought of after this has ended, just feel free to write me on Instagram, and I'll be happy to help you with anything you may need help with. Okay, so all right, thanks for today. Have a great week, and send me some x-rays that you took with these new techniques. I want to see them.